A strong Category 2 hurricane made landfall on an island in the Gulf Coast. Winds estimated over 100 miles per hour and a storm surge of over 10 feet resulted in significant flooding and damage to the infrastructure. Over 70% of the buildings on the island are damaged or destroyed, including public housing. Much of the island is covered in a layer of heavy metal contaminated sediment from an industrial area. Residents are displaced for weeks or months. Many never return. A not-in-my-backyard mentality impedes the timely rebuilding of public housing, which was torn down before former residents were allowed to retrieve any remaining belongings. Many former public housing occupants have been unable to return to the island because of the lack of affordable housing. These individuals have no voice in the recovery planning process because of restrictions that limit the participation to current residents. Such corrosive social dynamics build distrust among neighbors and further distress the vulnerable. Through the recovery process, it becomes clear that the disadvantaged face additional challenges. Most of the severely damaged neighborhoods are in low-lying areas characterized by large concentrations of low-income populations. Disruption of public transit in these areas poses great challenges for those that lack cars. A problem exacerbated by the closure of many neighborhood amenities, such as grocery stores. Many businesses are closed for months, including a large academic center that is the largest employer in the area. Jobs are lost as a result of these closures, and because parents are unable to find safe places for their children while they work. Most people are not adequately prepared to provide the documentation needed to access critical resources. The local housing authority experiences a five-fold increase in demand for housing assistance. The trauma and stress of this exact a toll on the health of the population, especially those with pre-existing conditions. At the 1-year mark, more than 10% of the population meets criteria for a probable mental health disorder diagnosis. 5 years after the storm, public housing still has not been rebuilt. This is not hypothetical. This scenario describes the impact of Hurricane Ike on the island of Galveston, Texas in 2008. For Galveston and communities like it, recovery from a disaster can provide a mechanism for addressing many of the factors that contribute to poor health status and vulnerability. Disasters, although unquestionably tragic, create new resources and opportunities to advance the design and realization of healthy communities.